pregnancy. Some people think getting pregnant every year is the best thing. Let me quickly have all my babies. It is very dangerous. All of that will be discussed here today. But for the next 2 minutes, I just want 2 people to speak on behalf of all of you to see from the government and your hope and belief in this government. One Hausa, one English. Motefi. Oh yeah.
Hello, good afternoon everyone.
Good afternoon.
I'm Umar Hadiza. On behalf of all of us, I want to say thank you first for coming through for us.
Don't worry.
For coming through for us, we're grateful. Thank you so much. And in respect of what we want the government to do for us is a lot. Some of us that gave birth before, a lot of things were free, but they are no longer free. We pay for virtually everything. Hands are not equal, so all of us are not the same. To the glory of God, some of us can afford it, but a lot of people cannot afford it. And most times when the government hospital go on strike, a lot of people die because of other hospitals we are having that don't have the facility. So please, we want to beg the government, whatever it will take for them to help people, reduce the bill is too much. The CS you're talking about, it's not implemented yet. A lot of people, like a colleague here now, is going on Thursday for CS. She's spending nothing less than 400 to 350,000. Yes, that's what they are spending. But initially, 212 that I gave her through CS, it was free. I did not pay a dime, but we are paying. There is nobody you go to in this hospital and tell that it's free that they will agree that it's free. So please, if there is any number we can be given to enable us call whenever we are in problem or we are in need of this facility, everything, we pay for everything in this hospital. It's a government hospital, not a private hospital. And that's why we are here, because we know they have the facility and they have the hands to help us. But it's no longer helping. It's not pocket friendly. We are all suffering. The rich, the poor, everybody is suffering. We are crying. We buy blood. We give blood.
This is how the renewed hope administration is. We have to communicate. We don't want to go on TV and say something and you come and say it is not so. So I am very, please give her a round of applause. When we have the management of this hospital explain to you how you can give birth for free. All of you seated here. And he's saying it in front of us, government, and in front of the general public, media.
The Honorable Minister of Health and the HMD, DG, and everybody present. Great pregnant women. Great pregnant women. I'm sure you all know me, or most of you will know me. We see ourselves here almost every week. Yeah, so about this year that she was talking about, well, for those on insurance, CS is free. Like when the Secretary rightly said. For those that have registered for insurance, the cesarean section is free. For those that have not registered, I know there is a fee that you have to pay, which the government has also subsidized. If you look at it very well, I'm sure that even with the review, there's a latest review, the cesarean section in this hospital is 80,000 naira. So, yes, it's 80,000. Then when you now add up the post-op medications and all that, it goes to about 140,000. So, to avoid all of this, just register for the insurance. The Environment Secretary is here, and she has assured all of us that the minister has said everything is free. But now you know, the insurance is here. Thank you.
When you need this clinic, look for the registration desk and register. You have to register. Health insurance, again, I repeat, is free. And you will deliver for free if you are under the health insurance. Thank you.
Good afternoon, you all.
Good afternoon, sir.
My name is Dr. Kazadi Mulombo, the WHO representative from Nigeria. And I'd like to use this opportunity greet you all because you will be the manifestation, the theme this year. Healthy beginning, hopeful future. And through interventions you've been benefiting from various initiatives, including the MAMII initiative. We are hopeful. We are hopeful that we'll preach by example with the offspring, with the happy beginnings, so that the child that will be born healthy, will have opportunity to grow and thrive and prosper. I'm sorry I'm joining you late. They kept you long. Not me, actually, because we're having another series of celebration for the World Day. So, happy World Day. We look forward to supporting. And I'm bearing the Mandate Secretary as witness, as she announced that insurance will be free. I will monitor that to make sure that it's really free and you benefit from it. Thank you again and
Thank you very much.
happy birthday.
First of all, the World Health Day is centered around this year's theme is New Beginnings, Hopeful Future. New and bright beginnings for pregnant women, hopeful future for the kids they would give birth to. That is why we have focused on them today, to give them health education, to let them be aware of what this renewed hope agenda has put in place to reduce maternal mortality and infant mortality. In the world, Nigeria is one of the highest contributors to how many women die due to complications of childbirth or at childbirth. This administration is determined to ensure that this data is a thing of the past. We have zero tolerance for maternal mortality or infant mortality. And as you have seen the pregnant women here today, they're very excited that we are joining hands with them to ensure that their delivery is safe and their baby is safe. Apart from that, there are specific programs that the federal government has put in place towards addressing not only the health of the populace, also especially for pregnant women and newborn children. We have partners like the World Health Organization. The World Health Day is a day that the World Health Organization was founded about 64 years ago. And their mission is to assist countries and developing nations like ours to ensure that health is not only the absence of disease, it is also a good quality of life. Now, in terms of the specific programs put in place for mothers and children to ensure that maternal mortality indices objectively verifiable that can be published and you can check, programs have been put in place to make this data better, to make Nigeria safer for pregnant women. The coordinator of the program called MAMII is here with us today. The country rep of the World Health Organization is also here with us today to show the gravity and importance of this matter. For women in the FCT, pregnant women in the FCT have free health insurance. It is a policy of this administration. And when you have free health insurance, your pregnancy, your delivery, and in addition, the baby you are giving birth to for the first year of its life has free health insurance. And the implication of this is that you must get proper care, timely care, and affordable. When we say free, we are not even talking about affordable anymore. Care for the pregnant woman. In simple English, delivery is free and childcare is free if you have the FCTA health insurance. And to register is very simple. There's a desk in every of our facilities. Ask for that facility, register as a pregnant woman, and ensure that your delivery is in a recognized health facility.
It is nice to be here today to join in the commemoration of the World Health Day 2025. And you heard the theme. It's a healthy beginning and a hopeful future. And for healthy beginning, that means that pregnancy, has to be well taken care of. And then, of course, for hopeful future, we want them to live beyond the age of 5. And actually the mandate of Mr. President Bola Ahmed Tinubu, and the directive of the coordinating minister to ensure that for every pregnancy, it translates to a baby and next. And there's no reason where pregnancy should be a death sentence. So the MAMII program, which is the maternal and the newborn mortality reduction innovation and initiative, is basically to see how to counter all those delays that leads to maternal death, either delay in seeking health care, delay in receiving health care, or even reaching health care. And so we have our strategy. Right from community, we mobilize the women to come to the health facility, ensure they have a good transportation, either through voucher ambulances, and then ensure that for those who require cesarean section, you heard it, at our tertiary institution, now as we speak, is free, but we are extending to these general hospitals to ensure that cesarean section can also be free there. And also we are ensuring that the facilities are revitalized either at the primary or the secondary. They are fit, for purpose to deliver safely, a pregnant woman. So that's what Mr. President's mandate is to the coordinating minister, and what we are working on MAMII, and then to ensure that for any unfortunate maternal that we report it, so we can respond and ensure it doesn't happen again.
I'm by name Ndubisi Joy. Wow, I'm so excited though. I'm very, very happy. Since this is my first child, but since I've been coming, I've not expected something like this before. But today, I know that today is a great day for me. I really want to appreciate that. I have to say thank you to them, that the works that they are doing, that they should keep it up. May Almighty Allah and may God keep on blessing them, that they should keep it up.